Welcome, everyone. We're waiting for attendees to join, and we'll start shortly. Okay, I think we're ready to start. Welcome to everybody, and thank you for joining the Boston University Institute for Global Sustainability for today's Research for People and Planet webinar on residential weatherization, energy security, and health disparities. My name is Patricia Fabian, and I've recently joined the IGS as Associate Director, as we've expanded our research mission to focus on planetary and environmental health. I'm also an Associate Professor of Environmental Health at BU's School of Public Health, and conduct research at the intersection of buildings, indoor air, health, and energy, with a focus on vulnerable populations, disparities, and sustainability. IGS would like to offer special thanks to the BU School of Public Health, who's our organizing partner for today's webinar, and also the Student-Run Energy and Sustainability Club for their promotional support. We're delighted to welcome everyone who's joined us and encourage you to visit the IGS's website at bu.edu/IGS for the Institute's expanded research on planetary and environmental health, climate governance, and energy systems to advance a sustainable and equitable future. I'll also note that today's webinar is being recorded and will be available on IGS's website afterwards. So now I'd like to introduce our panel in the order that they are presenting. So starting with Dr. Stephanie Ettinger de Cuba, she's an Executive Director of Children's HealthWatch and a Research Associate Professor in the BUSPH Department of Health, Law, Policy, and Management. Her research focuses on the relationships between social policy, family economic mobility, and the ability to meet basic needs such as food, housing, utilities, and healthcare. We're also joined by Brooks Winner, Senior Clean Energy Specialist at the Metropolitan Area Planning Council. In this role, Brooks supports Massachusetts communities that are planning and implementing clean energy projects and climate mitigation and adaptation initiatives. Our third panelist is Bianca Bowman, Climate Justice Organizer at GreenRoots, a community-based organization located in Chelsea, Massachusetts. In this role, Bianca leads community projects related to environmental and climate justice to achieve greater quality of life through collective action, unity, and education. So starting us off, just a little framing. We know that in the US, buildings consume around 40% of energy, and residential buildings account for about half of that. There's many policies and programs, both existing and new, aimed at reducing energy consumption. For decades, that was really the only goal, but now we have a parallel goal of reducing greenhouse gas emissions for a carbon-free future. These residential weatherization and decarbonization programs have largely been underutilized by those most vulnerable, including people living in older leaky housing, affordable housing, rentals, and in communities with a long history of housing disinvestment as a result of structural racism. Additionally, the critical role of community organizations in both informing and implementing these programs needs to be elevated. And there is a disconnect between these programs and their impact on energy insecurity and health. However, there is opportunity in the moment we are living today, and this panel will help us understand and explore that. I'll now ask Dr. de Cuba to pull up her slides. And while she's doing that, we'll remind the audience to post their questions at any point in time using the question and answers button. We'll try to get to them as many as possible during the discussion portion. So we'll have the presenters present first, and then at the end, have a discussion with everyone's questions, but please post as you go along. Dr. de Cuba, to you.
Thank you so much. It's really great to be here. I really appreciate being invited. I'm going to talk to you about energy security and health. But first want to sort of set the stage with some terms because every discipline has its own jargon. So when I'm talking today about energy security, what I mean is consistent access to enough of the kinds of energy needed for a healthy and safe life. in the geographic area where a household is located. That's a definition that the group that I'm part of, Children's HealthWatch, defined in this article in pediatrics. And the geographic area piece of that is actually really important because in some places we need cooling, in some places we need heating, and in other areas we need both. Oops, why is this not moving? There. The way that we define that measure is energy security is when a home is adequately heated or cooled with appropriate appliances and no turn-off notices. Moderate energy insecurity is when there's a threatened turn-off of utilities because of non-payment. And severe energy insecurity is any one or more of these various conditions. So either the gas or electricity is turned off, or the oil wasn't delivered because of non-payment, or the home was not heated or cooled appropriately for one or more days, or the home was heated with a cooking stove, so essentially an unsafe method. And we know that energy insecurity is really tightly related to health, and certain groups are more at risk than others, particularly at either ends of the life course. So children and infants, and then seniors in particular, and then also definitely people with any kind of chronic disease or condition. In early childhood, we know that energy insecurity is related to worse overall health, risk of being hospitalized, and risk of developmental delays. In childhood and adolescence, it's related to asthma exacerbation, poor sleep, depression, externalizing behavior, so that's like acting out, and also noise exposure. So like, opening the window in maybe a busy city and there's a lot of noise coming in, if you think about it that way. So like, then the behavior and the noise then combine to cause academic challenges. And in adulthood and in the senior years, we know that it's related to poor overall health, poor mental health, chronic disease exacerbation, again, poor sleep, and in some of the worst cases, stroke and mortality. But certain families are more likely than other families to be energy insecure in the first place. And one of those is, we know from our research with Children's HealthWatch, which is focused on young kids and again, like social needs and how they connect to health and development, that families that have a child with special healthcare needs are more likely to be energy insecure. So a kid with special healthcare needs is a child who needs more healthcare or therapies than the average child. So anything from severe food allergies to asthma, Down syndrome, or some kind of congenital condition can all be special healthcare needs. And that means that there's expense for the family and competing needs within the family, causing trade-offs. And that not just in families with children with a special healthcare need, but this is typically something we hear about with energy insecurity that is related to food insecurity, also dubbed heat or eat, or in other hotter places, cooler eat. Food insecurity is inadequate access to enough food for a healthy and active life. And there's a range of severity among households with children. The most severe level is child food insecurity, when parents are no longer able to buffer children from the scarcity of food in the household. And we know that food insecurity on its own is related, very strongly associated with poor health and development outcomes for the child and for the family overall. And our Children's HealthWatch research really bears that out. This is looking at moderate energy insecurity in the light blue and severe energy insecurity in the dark blue. And the odds ratios compared to those who are energy secure of households being either household food insecure or child food insecure. And you can really see how as energy insecurity worsens, so too does food insecurity. Another researcher, Diana Hernandez at Columbia, has done a lot of really interesting work related to energy insecurity and built on the stuff that Children's HealthWatch developed to really define 3 dimensions of energy insecurity. She talks about the economic dimension, so the pieces that I've been talking about related to financial hardship and the cost of energy relative to other income and expenses. And then also the physical aspects, the deficiency in the physical infrastructure of the home environment that impact thermal comfort or have caused the indoor exposures or increased energy costs. And then this behavioral aspect, the ways that families and households cope and try to improvise and counteract those effects. And they have really real consequences for families, increased environmental exposure, so the heat stress and cold stress, which in turn are bad for health, and hazardous exposures, gas leaks and pollution and other things. Health issues like the ones I mentioned before. So again, mental health, stress, asthma triggers. And then I think really importantly, these social consequences is really real fear families have of being separated from their children, because that can be a reason that child services can use when utilities are shut off to pull children from the home. Family disruption, where kids get sent to other or to other family members because their utilities are shut off at home. Or it's too cold or whatever. And then residential instability. And I asterisk that because utilities being shut off is one of the key reasons that families get evicted. So that is a really big problem. We don't have good national data about energy insecurity. There's a big national study called Accountable Health Communities that was funded by the Center for Medicare and Medicaid Services. And I'm not really wanting you to focus too much on the detail in this slide. It was a study looking at if you screen for social needs in the healthcare setting, can you reduce healthcare utilization if you help people with those needs? But I think the core point here is that this is looking at numbers of needs and combinations of needs as they increase. And all those circles are utilities. So you see it again, how common it is that people are struggling to pay their utilities. Again, like I said, there's no good national data set on this. It's not nationally tracked, and it's traditionally combined with housing costs, which makes it really difficult to piece apart. Yet we do know in the studies that we do have that there's this double burden of families who are struggling with housing instability and also energy insecurity. But one of the national studies that we do have was, again, from the same researcher I mentioned before, and she looked at disconnection notices and service disconnections and found that about 15% of households nationally in 2015 had a disconnection notice, and many fewer had an actual disconnection, and there were big disparities by income. But I think probably most interesting about her study is that she found that those who are most likely to receive a disconnection notice were households that were Black or Hispanic, had lower educational attainment, lived in a mobile home, were renters, lived in rural areas, lived in housing that was built before 1980, or had children in the home. And I just want to call out why might we see differences by race and ethnicity? It's really not anything inherent to folks who are Black or Latino or whatever else. It's about systemic racism. It's about inequities in income and wealth gaps, and intergenerational wealth accumulation that did not happen, going back to our history of redlining in this country, and the fact that we blocked mainly Black, but other families as well, from getting mortgages and owning homes, and the ongoing residential segregation that we have with really high housing costs. We know from research that on average, Black Americans are more likely to live in older homes, energy inefficient homes with structural problems, that they're outdated and inefficient appliances and faulty energy systems. And for renters, landlords may not be investing in upgrades, and that may be just outright neglect, but also prohibitive cost, especially for small landlords that just don't have that additional cash. And the result is a disproportionate burden of energy insecurity and the related poor health outcomes for families of color or households of color. And those sort of social fissures were only deepened in the pandemic. This is data from the Urban Institute and a study they did at the beginning of the pandemic in 2020. And there in that circle in the middle is folks who are struggling to pay their utility bills. You see about 10% of households overall reported that they were struggling, but for those who had already lost jobs or had their work hours cut, went up to about 16% of households that were struggling. And again, in the same study, they found big racial inequities in that, again, pre-existing the pandemic and because of our history of policy choices, that more of our Black and Hispanic households in this study were struggling to pay their utilities. And I imagine all of you have seen these headlines. There's a selection of few. This is an issue that's been ongoing, the struggle with energy insecurity for many, many, many years, but it has only gotten more extreme and more urgent with climate change and the extreme heat that we experienced over the summer, and also these incredible energy prices that we're heading into this winter, and the prediction of really record numbers of people struggling to pay their utilities. But we do have lots of solutions that are within reach. On the sort of micro level, there's physicians can write shut-off prevention letters to keep utilities on throughout the winter, particularly if there's a child or someone with a chronic condition in the home. But the challenge there is that arrearages still accrue. There is certainly privately funded fuel assistance, but that's charity-based and so patchy. So what we have are these really fantastic national programs, like the Low Income Home Energy Assistance Program, which research has demonstrated over and over how effective it is. However, it is severely underfunded and only reaches a fraction of those eligible. We've had a huge infusion of money in it this year ahead of this winter. There's still concern though that it won't be enough because again, there's so many more people that are going to be struggling this winter. And we also have a weatherization assistance program, again, very effective but underfunded. We also need more housing design and retrofitting. And I would say we really need cross-sector alignment of solutions that bring together in really thoughtful ways housing policy, energy policy, and climate mitigation strategies. So with that, I will end. And I put in this quote, this is from a qualitative study we did a few years back, I think really poignant quote from a mom who was talking about the stress of having her utilities being shut off. She said, I hate being scared. I hate getting up in the morning and hearing that drilling noise from the utility company. I'm like, oh my God, that's for me. They're gonna shut this off. So with that, I will turn it over to others. Oops.
Thank you, Stephanie. Brooks, I'll maybe ask you to go next and start sharing your slides.
Thanks, Patricia, and thanks, Stephanie. I'll just note that Children's HealthWatch, a presentation that your colleagues made several years ago, is the reason why I started getting interested in the connections between health and energy. So it's a real pleasure to be with you today. I'll also note that we did not coordinate much at all about the content of these slides, but sort of evolved in parallel to bring up some really similar themes. So great. Well, good morning, everyone. My name is Brooks Winter, and I'm a senior clean energy specialist at the Metropolitan Area Planning Council. And my presentation is The Pathway to Decarbonization Starts with Justice. So just quickly about MAPC, we're the regional planning agency serving the 101 cities and towns of Greater Boston, and our clean energy department works to facilitate a just transition to clean energy throughout the Greater Boston region. I specialize in building decarbonization, energy efficiency, energy equity issues, and the intersections of health, housing, and energy. I'm also a member of the Stewardship Council for NewHab, which is the Network for Energy, Water, and Health in Affordable Buildings, a national network of people working to ensure that everyone has a home that is affordable, healthy, and sustainable. So if you're interested in the themes that we raised here today and want to connect with some really great folks who are working on these issues across the US, would encourage you to check NewHab out at newhab.net. So my presentation today argues that our failure to address longstanding equity issues with decarbonization policies and programs is holding us back, and we can and must do better. There is no pathway to zero emissions that doesn't prioritize the needs of communities of color and low-income folks, and we won't meet our climate goals or achieve the kinds of health outcomes that Stephanie was highlighting if we don't solve these inequities. So because I work at a regional planning agency, I'm required to love maps. It's in my contract of employment, not really, but it might as well be. So I'm actually going to jump over to another window here. Let's see if I can do this. Okay, are you seeing? Okay, so this is a really handy story map developed by Emmeline Luck and her team at the Northeast Energy Efficiency Partnerships, or NEEP. And I think it does a really good job of laying out why energy efficiency and building decarbonization are racial and economic justice issues. So Stephanie mentioned redlining. Patricia mentioned the structural racism that is causing a lot of the problems that we're here to talk about. And this is a map that sort of demonstrates that really well. So this is the redlining map from Greater Boston. And this is a map of current day energy burdens in our region, showing that communities that were redlined now often face higher energy burdens, as well as higher surface temperatures. They have less green space and higher utility costs, lower housing values, and that communities of color and low-income communities also have lower quality and less efficient housing. So that's sort of drawing the connections between structural racism and a lot of the issues in our housing stock. So we also know that in Massachusetts and across the US, our clean energy programs are consistently underserving people of color and low-income communities. For example, one study from the UC Berkeley and Tufts University found that adjusting for household income, so households with the same median income, Black and Hispanic majority census tracts had less solar installed compared with those areas with no majority ethnic group. And white majority census tracts had installed 21% more solar. So that's on the solar side. On the energy efficiency side, LED light bulbs have been the sort of main focus of lots of energy efficiency programs for the last several years. But a study by Tony Reams at the University of Michigan, who is now the Deputy Director of Energy Justice at the US Department of Energy, found that LED light bulbs were twice as expensive in poorer neighborhoods in Detroit. So these are just two examples. There are many studies showing similar discrepancies and disparities along socioeconomic and racial lines. So I want to connect this to our climate goals. Patricia mentioned that about 40% of energy is used in buildings. About a third of our total greenhouse gas emissions in the US come from buildings. And despite having nation-leading energy efficiency programs here in Massachusetts, we love to point that out. We're number 1 or 2 regularly. We're already falling behind on our 2030 and 2050 climate goals. For example, we know that we need to, that in order to reach our goal of reducing emissions 50% by 2030, we need to switch 1 million homes to clean heating systems like heat pumps and deeply weatherize about 20% of buildings. But a recently published report, the Boston Climate Progress Report, found that Boston and Massachusetts are both way behind on our heat pump goals. And I think similar could be said for deep energy retrofits. One of the biggest challenges for us to figure out is this: how do we decarbonize all of the rental housing and multifamily housing, especially in low-income neighborhoods and communities of color? We more or less know how to decarbonize a single-family home in a wealthy suburb. We have plenty of work to do there as well, but the solutions are pretty clear. And the market is serving that customer segment. But can we decarbonize a triple-decker in an environmental justice neighborhood? I would argue that we should focus our efforts on figuring out these issues now, both because it's the right thing to do from an environmental justice or from a justice perspective, but also because we need more time to figure out the hard stuff. The approach in the past has been, we'll start with the early adopters, often wealthy white folks in the suburbs, and the so-called low-hanging fruit. We can figure out the hard stuff later. Recently, though, we're seeing the effects of what happens when you punt those decisions down the road. With each new study, we confirm what we already know, that people of color and other marginalized groups like renters are being excluded and left behind. The more we push for decarbonization and electrification, the more we run into these issues. For example, there are real and valid concerns that if we do retrofits in all of those buildings, Without protections for renters, we could drive displacement. And there are also concerns that if we shift away from gas heating to heat pumps and electric heating and cooling in a way that only wealthy people can afford to do first, low-income folks would be stuck with higher energy burdens as the only ones left on the leaky, polluting, and increasingly expensive fossil gas system. So it's time to move beyond the low-hanging fruits, the easy wins, and the paths of least resistance that are reinforcing the inequities baked into our energy system. And this is me reaching for some not low-hanging fruit. We're finding solutions, though. I really like the solutions that Stephanie highlighted, and I'll add some more to the mix. We need to support the ones that we have, and we'll probably need to find more, but some that I wanted to highlight here. So partnerships. One of the most effective solutions that I've seen to equitable decarbonization is resourcing community-based organizations and organizers like GreenRoots. We're going to hear from Bianca Bowman later. Their knowledge of the needs of their communities is a huge and really undervalued asset in our quest to decarbonize our buildings. We also need to figure out how to do retrofits without displacement, and there's some good news on that front as well. I like to highlight that rent control is a climate justice issue, that if we can limit rent increases, then we enable decarbonization without displacing people. And there are some really good examples. The Mass Clean Energy Center is figuring out how to decarbonize both affordable and market rate triple deckers through its triple decker pilot program. And MAPC is partnering with the Boston Housing Authority and Alternatives for Community Environment, a Roxbury-based environmental justice organization, to connect Section 8 landlords with technical assistance to install clean energy that benefits them and their tenants. So connecting affordable housing vouchers with clean energy. We also need equitable rate design to enable electrification, that issue of people, poor folks getting stuck on the gas system, and challenges to electrification for low-income residents. But there are good examples of that popping up all over the country in advocacy spaces. And then we need to be prioritizing environmental justice communities for investment. At the federal level, the Justice 40 initiative is making sure that 40% of funding for energy and climate goes to underserved communities. And here in Massachusetts, for the first time, the Mass Save program has clear equity targets and performance incentives, meaning that the utilities running the programs don't get paid if they don't make progress on serving customers equitably. We're going to need a lot more electricians and plumbers and weatherizers, and organizations like Emerald Cities Collaborative and the Mass Clean Energy Center are working to ensure that women and minority-owned businesses are represented in the workforce that we're going to need to decarbonize buildings. And I'll end on a similar note to Stephanie, which is to say that health, housing, and climate are all connected, and we need more cross-sector collaboration to address our interconnected crises. So thank you. Here's a picture of a quokka, and I'll turn it back to Patricia.
Thank you, Brooks. Great presentation. Bianca, can I ask you to pull up your slides?
All right, should I go ahead and start? So yeah, I'm similar to Brooks. Stephanie and Brooks both set me up really well to provide an example of all of the inequities that we've been talking about, and the importance of involving low-income communities in building decarbonization as a priority. So I'll just go ahead and start by giving a little bit of background on Chelsea and East Boston, Massachusetts. We mainly focus, GreenRoots as an organization mainly focuses on Chelsea and East Boston. So for those of you who may not have as much background on these communities, Chelsea, Massachusetts is the smallest city in Mass. It's got over 50,000 residents, which is probably a bit of a low number given the amount of undocumented residents that live in our community. We have 73% of ethnic minorities. People identify as ethnic minorities in Chelsea, and a majority of those are Latino. And 24% of our community lives below the poverty line. Over in East Boston, it's a similar size community. It's 5 square miles, but 3 miles are used by the Boston Logan Airport. There's also a high Latino population and a high poverty population. So those are the communities that we mainly work in and do organizing in. And some other facts about our communities are that they are highly used for industrial purposes. So a lot of the space is taken up in our communities by things like heating fuel and large oil tanks, really large salt piles right on the waterfront, which looks very different than the waterfronts in, say, Cambridge or Boston. And we are providing these services as communities for the rest of the Boston area and the Northeast and even Mid-Atlantic. We also have a large produce center in Chelsea and on the border of Chelsea and Everett that delivers produce to most grocery stores from the Washington, D.C. area up through Maine. So a ton of trucks are moving through our communities, and that ends up causing some issues with air quality. We have low access to tree canopy and public green space, which causes issues in the summer for our residents for urban heat, and low access to cooling spaces. We have a lot of impervious surfaces, which makes us a high flood risk community due to being right on the waterfront. And as I mentioned, we have a lot of issues with air quality due to all of the trucks moving through both Chelsea and East Boston, as well as the Tobin Bridge going directly over our community as well. So we have really high rates of asthma hospitalization in our communities. So, that kind of sets the stage for all of the inequities and is an example, I think, of the importance of focusing on these communities first for building decarbonization. And just to talk a little bit about what GreenRoots does in regards to all of these issues, we work, we're an environmental justice organization, which to us connects to many different sectors. And as Brooks just mentioned at the end of his presentation, it's really important for us to be working in all of these different spaces because that's justice, and environmental justice connects to everything. So we work on things like food access, access to public transit, access to clean energy, and access to the waterfront, open space, and health as well. So kind of umbrella term environmental justice really connects to everything. And the importance of our work as a community-based organization is that we really, whenever creating change or having any activism within the community, it's being on the ground and connected directly to residents really builds a lot of community power. And when working with larger entities, our connections with smaller groups, other small groups, as well as different neighborhoods directly in the community really allows for community buy-in and expertise to be centered when creating decisions. So I am going to talk now about the building decarbonization challenges that we face and have noticed in Chelsea and East Boston, which Brooks and Stephanie have already done a really great job of outlining. But thinking about it in a specific, from my perspective as a community organizer, as you can see in this picture, most of the streets in Chelsea are really highly dense, the kind of classic Boston area triple deckers. There are a ton of renters and landlords that are absentee landlords. And so that creates a lot of issues for residents. Before we even think about building decarbonization, thinking about things like heating and cooling, most people don't have access to air conditioning and are using window units that are probably inefficient. Most of these houses are really old and aren't insulated well. We also therefore, our decarbonization is often just not a priority in a lot of people's minds. And that's something that's really important to think about when you are creating some sort of pilot or decarbonization strategy, is you need to have that community buy-in and address those challenges first. And if someone's biggest concern is how am I going to pay for rent or put food on the table next month, it's really hard to emphasize to them the importance of building decarbonization. So that's something that is, I think, really important as a community organization to bring that perspective from those communities to groups that, well-meaning are trying to, both municipalities and state entities are trying to emphasize decarbonization, but there's usually some sort of knowledge and experience gap between our communities and those entities. And then the other issue is also just the distrust that EJ communities have for, I think, a lot of programs, or even working directly with municipalities and state officials, or programs, because many EJ communities are already overburdened by programs and research, as well as are overburdened by just, the day-to-day difficulties of dealing with all of these health disparities and challenges on accessing public transit. So just kind of making sure that that's being considered when looking for solutions that we can connect to people is super important. And then some opportunities with EJ communities regarding building decarbonization is that weatherization is a need. So that's one really good entry point that we've noticed is helpful with talking to people and creating pilot programs or designing programs around decarbonization, is that, people understand that heating and cooling is going to be affected by if your house is retrofitted. So that's a potential entry point, and that energy efficiency is important. Other potential opportunities are in microgrids and community-owned land, or shifting the land to being community-owned. So community land trusts is one of those opportunities. GreenRoots, for example, is incubating a community land trust called Comunidades Enraizadas in Chelsea. And what a community land trust does is buy land, acquire land as a 501c3 organization, and essentially ensure that that land or property is available to low-income residents in perpetuity. So that's been really important. And working with those kinds of organizations, community land trusts, on building decarbonization, both continues affordability and access to affordable housing, as well as emphasizing building decarbonization if you're able to kill two birds with one stone. And then lastly, if EJ communities are prioritized for decarbonization, there's just, as Brooks was talking about, it's just an opportunity for justice, and to emphasize the importance of making sure that we have an equitable transition. And I think that from there, we'll just move on to a couple examples of how we've been involved in solutions in the past. So right now, there's a program that we're working on. GreenRoots, as well as the Community Land Trust Comunidades Enraizadas, are exploring with the Sasaki Foundation some potential opportunities to put green roofs on affordable housing buildings. So that kind of puts the issues together of, access to open and green space in the community, as well as air quality issues with affordable housing, and also potential need for a retrofit, because you would have to retrofit a building if you're going to put any kind of green roof on it as well. So kind of what Brooks said of combining different people and different sectors and different areas of expertise to look at these issues is really, really helpful. Another thing I wanted to mention, especially because Patricia is the moderator here, is the work that we've done with C-Heat, which is a collaboration between the Boston University School of Public Health and GreenRoots, identifying urban heat islands in Chelsea and working with an academic institution, prioritizing community-based participatory action research, having a relationship with the community-based organization where an academic institution asks for the needs of the community before designing the research has been super, super important and really, really successful in our case, and have designed these two pictures on the right on this slide show a old lot that was unused for over 10 years. That's now been transformed into a cooling focused community space. So some really exciting things that are going on with that. Some more information about C-Heat, and included a map just for Brooks. So we have some mapping in here. And then other solutions, I just wanted to include this because this is some cool information if people want to look up. Solarize Eastie is a solar panel program that we have going on in East Boston, trying to get East Boston more involved and lower income residents involved in having solar panels on. And I think I'm running out of time, so I'm just going to run through a bunch of slides. But
okay, Bianca, you're fine.
Okay. But just wanted to emphasize that the importance of working with community-based organizations really allows for that community expertise and buy-in in larger projects, which I think is hugely important with energy issues and energy access. And something else I wanted to mention is that when involving a community-based organization, if you're someone from a larger nonprofit or an agency or a municipality, something that's really, really helpful in actually working with the community-based organization in a positive way is to develop a relationship with the organization and the community before planning or starting the project or research that you're planning on doing. And that's just been a lesson that I've learned having worked at this organization and worked with Patricia and other municipalities, is that projects are always much more successful when starting from the perspective of the community members and directly working with neighbors and figuring out what the needs are and going in. So in a decarbonization setting, something that would be important is just gaining a level of gauging knowledge of the community on the importance of decarbonization, if they even know what it is, if they understand how it's connected to climate, or if they know that there are opportunities to get retrofits on their house, whatever programs are already available. So kind of thinking from that perspective has been really successful for us. And I think I'll just end it there.
Can you post the photo of the green space the way it looks now?
Yes. Well, so here on this last slide, you can kind of see the photos. On the left is the kind of the Google Maps photo of the lot, and then the two pictures on the middle and the right are the newer photos of this transformed community space. So used to be empty, and now there's a lot of green spaces, there's seating, there's a swing, and there's going to be a lot of bulbs that we planted this fall will hopefully be coming up in the spring. So really just bit by bit, making sure this space is available to people. We have tents up tents and umbrellas up in the summertime. And another success story with this is that all of the community members showed up to a city council hearing around whether this lot would be accepted as permanent municipally owned green space. And there was a chance that they vote no on that in favor of developing this lot. And so many community members that were involved in this project showed up to the city council and advocated for this to be a green and cooling focused space. And they won, which was awesome. So the city council voted yes. And so this will be a park in perpetuity, which is really exciting.
Great, thank you.
Yeah, thank you.
Well, thank you to all three panelists for really, really great presentations. I'll ask everybody to come back and unmute and kind of start off the conversation, asking some questions, bringing it back to decarbonization and health disparities. So just general question for the panel, and a reminder for anybody on Zoom, you can just post your questions in the question and answer, and we'll either sort of bring them in or answer directly. How did I lose this? Okay, sorry. So the first question is really about the reason actually I was excited about this panel is because we have sort of policy, right, regional initiatives, and then community. And just curious to hear your comments on whether the general population and policymakers and communities, do we all understand the linkages between decarbonization, health, and health disparities, given that health actually drives a lot of decision making and funding? So maybe can I ask you to comment on that? Yes, no, and then how do we get there?
I think it's the rare policymaker that gets that. I mean, there's a few that are focused on environmental health that understand, but I would say more often than not, it's sort of thought about in a very siloed fashion, and sort of the value of it towards climate change, but then like not taking it to that next step of really understanding how it could affect a day-to-day life and health and healthcare and across generations as well. So yeah, I think that is a big need is explaining those linkages. I mean, even in the scientific community, I'm not sure that that's always a connection that people see. So yeah, I think it is a big need across the public policymakers and just broadly sort of people in research as well, to like break down barriers and doing the sort of thing that we're doing right here, which is people with very different expertise coming together and trying to eliminate these linkages?
Yeah, I'll say I think we're making progress, and there's an example just from my own teams at MAPC. You know, I think we have been doing an increasingly good job at connecting. So we have a public health department and a clean energy department and a housing team, and we've been really intentional about finding ways to learn each other's languages and learn enough about each other's discipline to work effectively together and make sure that things like housing policy and climate policy aren't conflicting with each other. So I think that's positive, and I see that happening elsewhere. But I also think that there are still a lot of structural impediments, and like the silo walls are like, you know, the Department of Housing and Community Development isn't talking with the Department of Health and isn't talking with the Department of Energy and the Energy Efficiency Program, the Weatherization Assistance Program. They may be like even housed within the same entity, a community action agency, but if that community action agency isn't seeing like the two programs as connected, I think some of them do a good job of that, but some of the other programs are still catching up on those connections, particularly when it comes to energy and health.
I'll just jump in and say, I think also one of the places that we see a lot of the challenge with connecting all of these is in funding and receiving any kind of federal funding or state funding. Is a lot of times they're really siloed for what you are supposed to be able to use things for. And there's, you know, differences in access to funding for affordable housing versus open space versus recreation. So that's something that I think we've been advocating for as much as possible with entities that, you know, like the EPA or federal or state entities that make funding a bit more accessible to community-based organizations or anyone who's doing work across multiple different issues that should be connected.
Great. So that was actually one of the questions. Maybe I'll build off on that a little bit. Is that examples of funding that actually sort of takes all these different dimensions into account and include funding for communities in a substantial way. I think I've found that a lot of the research funding for myself includes very small pots of money for community organizations. And so we've had to be creative in terms of how to do that. But so examples of sort of funding models that do that well.
So I'll give one that is another connection between me and Bianca, which is that a project that I have been working on with over the past few years, funded by the Barr Foundation, a big private foundation here in the Boston area. Money going to the Metropolitan Area Planning Council, where I work, and the Mystic River Watershed Association, a kind of grassroots environmental organization. We are providing funding to community organizations like GreenRoots and Bianca and municipal governments to fund what we call COVID safe cooling strategies. So started in the wake of COVID, but it's really about building climate resilience and resilience to extreme heat. And I think it's a good example of getting money to communities and community-based organizations to really dive into this work. B, connecting health, climate resilience, and then kind of long-term climate solutions. We're starting with pop-up parks like the one that Bianca mentioned, getting air conditioners distributed to people that don't have cooling in their homes, but then also, where possible, trying to turn those sort of short-term emergency responses into long-term opportunities for people to weatherize their homes or turn those pop-up parks into permanent installations. So I think that's one good example, not to make a shameless plug, but I think examples like that of funding that is flexible and collaborative, and also getting money to organizations that are doing great work at the grassroots level is going to be really important.
Any examples? That's a great example. What about at a national level? Because I feel like so much of the policy then is US, right? Or the world, right? We're not the only ones obviously thinking and trying to get this to work. How do we then scale the kind of smaller location geography-based examples that seem to work up to being incorporated more into the larger pots of national funding. Any examples there or ideas of how we can do that there?
I think so. Some of this has begun in the Federal Justice 40 program, in engaging individuals who work for community-based organizations in, there's a White House EJ Council. And so there's been some federal, during this administration, there's been some federal involvement with getting, Justice 40 funds, which are direct federal funds to community-based organizations. I think that, and I think I would need to think for a sec about your question about how do we use these smaller pilot mitigation efforts and uplift them. And I think that's one opportunity for a role of connections between and relationships between smaller organizations and larger institutions. Is that's where those institutions might be able to come in and spotlight or uplift those solutions. Another thing I was just going to mention is just having any way of larger institutions that have more capacity to deal with things like federal grants or just like much larger grants that small community-based organizations don't really have the time to deal with, an audit, or kind of, this is, I guess, getting more into the weeds of grants, but dealing with things like really managing the money that could come in from a federal entity, I think is one of the challenges. And that's a opportunity also where larger organizations and smaller organizations can work together. I think the example that Brooks gave of essentially MAPC and Mystic River Watershed Association managing larger grants from the Barr Foundation and giving out smaller pots of money to local places has been really successful because, then we don't have to worry about managing the larger impact of all of the things that come with private foundation grants and federal grants, where you have to do a lot of work on the back end of explaining what you're using the money for and how and where's it going and all the tax stuff. So I think those relationships are really helpful.
So there's a related question about funding in the chat. Do you anticipate any money from the Inflation Reduction Act could be used in this manner to support funding and scalability?
Yeah, the short answer is yes. I think the Justice 40 initiative that Bianca just mentioned and that I brought up in my presentation will hopefully help with that. It's sort of the setting the floor of investment in underserved communities, but I also think that there is, that there's just going to be a lot of money coming, both from the Inflation Reduction Act, but also from the bipartisan infrastructure law, and a lot of communities and places around Massachusetts and the US are still spending ARPA money as well. So I think, it's a good problem to have to finally have federal investment in this work. But I think there's a lot still to do to make sure that it's being wisely and equitably spent. So that's, and I think that's where it comes down to local advocates, and like a lot of this money states are trying to figure out how to spend right now. So people who have good ideas about where to invest should be making connections with the people who are making those decisions. And like it's happening now and in the next year or so.
There's another question in the chat that I'm going to modify a little bit to ask both Stephanie and Bianca and Brooks to weigh in on. So the question is, how can municipalities do a better job of not overburdening communities and working to accelerate a just energy transition? I'm going to amend that a little bit to say also researchers working with vulnerable populations, because there's a community-based side to this, but there's also just the fact that so much research focusing to study vulnerable populations who are already overburdened. So there's kind of the 2 points of view there, and maybe Stephanie can ask you to weigh in first.
Yeah, I mean, I think that it's a really important question and always something to be considering. I think part of it is getting back to Bianca's point of building those relationships with community-based organizations, groups that are really deeply rooted in communities, and being open to the fact that maybe you're going to hear back from that community organization, not now. There's too much going on, and this is not a good time for that. This is not a good place for whatever the opportunity is. And I think, that's a really important, to have that kind of, and build that kind of an honest relationship. That's not something that happens overnight. That takes time and trust to build that kind of relationship, for someone to say, yeah, interesting idea, but no, or yeah, this is great, but here's how I change it, and being really, deeply rooted in whatever community it is, and not presuming that you know what's best. Just going back to the other question too, I know this is like extremely like 30,000 foot, but I think the part of the issue of why these things don't get connected is because they move legislatively so separately, and that is an ongoing challenge, not just with stuff related to climate and housing. We hit this with, family policy as well, that, policies get made that are like directly in conflict with each other because they're in completely different realms. So I think that's where having, very deliberate coalitions and groups that are bringing in the expertise across sectors is essential, because I may not know the fine detail of some climate legislation, but it may have a very direct impact on some sort of other policy, and to have those different groups together, working towards a common goal, I think is incredibly important. And to that end, also NIH study sections that are reviewing grants that are, very siloed as well, instead of bringing across, expertise from, all these different sectors. And I think NIH has started to do that kind of thing, but it is slow progress. So.
Yeah, thanks, Stephanie. I also will just jump in, if that's okay, Patricia, on the question about municipalities. I think that it's kind of a similar, municipalities, I think, especially in Massachusetts, probably other than Boston, which is huge, deal with a lot of the same capacity issues that community-based organizations do. So that's something that, we understand. I think that something that's helpful to think about is the different levels of engagement that municipalities can offer to community-based organizations and community groups in any kind of project. So say there's some sort of community, process that you want to have done, or some sort of community advisory group or council. I think reaching out to different groups and saying, hey, like, I know we've been involved with you a lot recently and asking you to do a lot of community engagement for us. What's your capacity right now? And what level do you think you would be able to be involved in this, if at all? So I think that kind of creating more paths and different paths at different times for community groups to be involved is really helpful, because sometimes, us as the CBO, we can just consult on some sort of municipal project, and then at other times we can be really heavily involved. So I think creating different pathways for involvement is super helpful. And then jumping also onto what we were talking about before with building relationships with academic institutions for research or other organizations. I think that something else to think about is to go so far as to build a relationship with an organization or a community group before you even have an idea of a research project or a plan whatsoever. And that's really thinking like 5-10 years down the line, right? So you're really just trying to build that relationship, and that can look like, I would love for you to speak at a class, or I would love for you to, this group of people to come, just visit your organization or visit your community, or, just really developing that relationship before there's a project or plan, I think is really
super important.
Yeah.
I'm going to jump in just because we are at the hour, and I want to make sure I say thank you to our wonderful panelists for interesting presentations and discussion. I encourage everyone to follow up afterwards. And thank you to the panelists and those Zoom attendees for their interesting questions. Thank you again to IGSBU Partners, School of Public Health and Energy and Sustainability Club. And a reminder that this webinar will be, the recording will be available at bu.edu/IGS. So with that, I think we'll wrap up 12 exactly. And thank you again.
Thank you.
Thanks, everyone.
Thanks, y'all.